Hi there, I'm Chet Kuhn with Medicare Hero, and today I'm going to be walking you through how to shop for Medicare plans with the new and improved Medicare.gov Plan Finder Tool. The first step you're going to want to do is go to Medicare's website at Medicare.gov. Once there, you'll see this page, and you'll want to get started with the Plan Finder Tool by clicking the blue button that says Preview 2021 Health and Drug Plans. So once you click that button, it's going to take you to a page for the Plan Finder tool. Now, you essentially have two primary options up here towards the top of the page. For those of you who are currently on Medicare and you have Medicare coverage currently, you can log into your Medicare.gov or your MyMedicare.gov account if you have one, and that will provide you the most customized solution as you shop for plans. Because not only will it show you the coverage you're currently enrolled in, but it's also going to give you access to any medications that you filled during the previous year. That way, if you don't know your prescription drug list offhand, you'll be able to see any prescriptions that you filled in the last year, and you'll be able to add them to your drug list and compare prices. If you're new to Medicare, you don't have Medicare yet, or if you just simply don't know your Medicare login information, then you can just continue on and do the very same thing, which is how we're going to do it today. So rather than clicking the login or create account button, we're just going to click the continue without logging in. Now it's going to ask you a few simple questions to get started. First, it's going to ask you, what type of 2021 coverage are you looking for? Now, there's 5 different options here, but I would highly recommend selecting one of the first 2, and I'll tell you why. So you can either shop for Medicare Advantage plans or standalone Part D prescription drug plans, okay? Now, people who are shopping for standalone Part D drug plans almost always pair that coverage with a Medicare supplement or Medigap policy. It tells you here that you can compare both the Part D drug plans and Medigap policies. I don't really recommend it. You're welcome to. The reason I don't recommend it is because Medicare.gov just really gives you very, very generic information on the Medigap plans, and it can be a bit confusing. They don't give you, they just give you a wide price range that Medigap companies charge with very generic information. I find that for most people, it ends up confusing more people than it helps. So if you're looking for drug plans, I would just click standalone prescription drug plans at least. I would just select this option here, which is the one we're going to use today. There's also, you can shop Medigap plans only. Again, I wouldn't recommend that just because it's a bit confusing. And you can also say, I want to learn more about Medicare options before you see plans. And that's just going to take you back to the generic information in Medicare's website. So if you want to shop for prescription drug plans or Medicare Advantage plans, I recommend selecting the corresponding option, one of the first 2 options. So for today, we're going to use the standalone prescription drug plans. So we're going to scroll down after clicking that, and we're going to enter our zip code. So I'm going to enter a zip code here. And then if your zip code overlies multiple counties, it'll ask you to select which county you're in. So this zip code overlies both Collin and Denton County. So I'll just select Collin County. And then it's going to ask one more question. Do you get help with your costs from one of these programs? Essentially, this is just asking you, do you get government assistance, or are you eligible for a form of welfare? So there's Medicaid, supplemental security income, and a few others. If you're, this is just for low-income earners who qualify for some type of government assistance program. If that doesn't sound like you, just click the bottom option. This is going to be the one most people select. You're just going to want to say, I don't get help from any of these programs. Again, that's what the vast majority of you will select. Okay, next they're going to ask you, do you want to see your drug costs when you compare plans? I highly recommend saying yes. If you take any medications, this will actually calculate the specific copays and costs for your particular medications. So if you do take any medications, you'll want to select yes. And then it says, how do you normally fill your prescriptions? Retail pharmacy, mail order pharmacy, or both, or either. This is just going to show you pricing at different locations. So for today, I'm just going to select retail pharmacy and click next. Okay, now we can begin entering our prescription drug list. So I'm going to enter a few medications here. I'm going to start by entering lisinopril. And if you just start typing the name of your medication, it will populate a list here for you. And I think I misspelled it. There we go. Lisinopril. We're going to say add medication. And then it's going to ask us a question about our lisinopril. It says, what dosage do you take? And it gives you all the different dosages available. I'm just going to select 20 milligrams. And then it's going to say, what is the quantity of this medication you get filled and how often? So we're going to say that we take lisinopril once per day. And we're going to say we fill it each month. So that would be 30 tablets that we get from our pharmacy each month. So we're going to leave that the same. And we're just going to click this green button that says add to my drug list. And just for the sake of example, I'm going to add one more medication here. I'm going to add venlafaxine. And I'm going to say add drug. And then again, you can select your dosage. And I am just going to come down here and I'm going to select the 150 milligram of venlafaxine. And I'm going to say add to my drug list. And I'm going to say for the sake of this example that our drug list is complete. So down here at the bottom of the page, I'm going to say done adding drugs. If you wanted to add some more medications, you can just keep clicking find and add drug, and you can continue to build your drug list. Next, it's going to ask you which pharmacy you use. So you can either search for the name of a particular pharmacy in your zip code, or you can just scroll down and this is going to pull up a list of the pharmacies nearest to your zip code. So I'm just going to scroll down, I'm going to select a CVS, and we will select a Walgreens. You can compare prices at up to 5 different pharmacies, and it's typically a good idea to select a few different options. Pharmacies work with these prescription drug plans, and they can either be out of network with a drug plan, they can be a standard pharmacy, or they can be a preferred pharmacy. Preferred pharmacies are where you always get your best pricing. So if you select a few different pharmacies, it will tell you which pharmacy will get you the best pricing for your medications with each plan. So now we are on the results page, and it tells us there are 35 different prescription drug plans available in Collin County. So as we scroll down, we're going to start seeing this list of plans. Now, this is really important. The way that this Plan Finder tool works is it's sorting the plans available based on my medications and the cost of those medications. And what it's doing is it's adding up the total cost for the entire rest of the calendar year, including the monthly premiums of each plan, in addition to the deductible, if there is a one on your plan, and the copays of your medications. So this is specific to you, and it's adding up anything you could possibly spend throughout the rest of the calendar year. Again, premiums, copays, and deductibles, all into one number. And that number can be found right here. Okay, so this is how much this pricing tool predicts you'll spend on everything related to your prescriptions that you entered if you fill those prescriptions regularly as you entered them all year long. So in this example, it predicts I'm going to spend about $213 on medication costs, including monthly premiums, deductibles, and copays. Now it's sorting all 35 of these plans from the least expensive plan for me at the top right here down to the most expensive. So the first plan is suggesting that it's going to cost me about $213 over the course of the year in all of my drug costs. As I scroll down, I'll see that number start to increase. The next plan is going to cost me about $255. The next one is about the same, $255. Then it goes to $265, $277, and they continue to get more and more expensive as I go down. Okay? There's truly no one best prescription drug plan for everyone. It 100% depends on which medications you take as to which prescription drug plan is going to be best for you. So 9.5 out of 10 times, the best plan for you is going to be the first plan recommended here at the top, because that's the prescription drug plan that's going to have the lowest overall cost for you. Now, if you want to look at this plan in a little bit more detail, you can just come down here to the bottom and there will be a blue button that says Plan Details. Just click on that and it's going to show you some more information about this plan. And this particular plan is called the ClearSpring Health Premier RX plan. Excuse me. It has a total monthly premium of $13.80. So that's how much we pay each month just to have the coverage. Now there's a deductible on this plan of $445. That's how much you would pay out of pocket before your coverage kicks in for the year. If we continue to scroll down, it's going to give us a bit more generic information. So this little chart here is just generic information on how much we might pay for different medications based on which tier they fall on. So if you need a medication that is a preferred brand of this particular prescription drug company and it's a generic medication, you'll likely just pay a $1 copay. If it's a generic, you'll pay, but it's not the preferred brand, you'll pay a $3 copay and so forth. For preferred brands, it's $40 copay, and it continues on. Now this is during your initial coverage phase. So once your deductible has been met for the year, then this is how much you'll pay, is kind of what they're showing you here. The next category over here is how much you'll pay during the donut hole or the coverage gap. It's the same term, donut hole or coverage gap are used interchangeably. So during the coverage gap, you'll pay 25% for generic medications and 25% of the cost of brand name medications. And then finally over here, it's going to show you if your medication costs are high enough to get you out of the donut hole, then after the donut hole, you'll enter the catastrophic coverage phase. And during that catastrophic coverage phase, this is the amount you'll pay for each of your medications. Okay. With all that said, that's complicated and confusing. I highly recommend, scroll right on past that and let's get to your personalized information that's much more helpful to you. So the next section here is going to tell you your pharmacies that you entered. We entered a Walgreens and a CVS. You see there's green checks by both of them because both of these are in network with this ClearSpring plan. But what you'll notice here is Walgreens is a standard pharmacy and CVS is a preferred pharmacy. You'll always get your best pricing at preferred pharmacies. So we want to scroll down and look at our pricing with CVS. So if we continue to scroll down, we'll see here's CVS pharmacy, and now this tells us our particular pricing. So the first column here tells us how much the retail price of our medications is. So lisinopril is about $6.50 and venlafaxine is $9.55. This is about how much we'd pay if we didn't have any insurance. Next, they tell you how much you're going to pay before the deductible has been met. So for lisinopril, we're going to pay $1 at CVS and venlafaxine will pay $3. So total each month, we're going to pay a $4 copay for both of our medications combined. Now, if your medication costs were high enough to get you into the coverage gap, then right here, it's going to show you the cost of each of your medications while you're in the coverage gap. And then finally, it'll show you how much each medication will cost you after the coverage gap is over. But even better, even more simple than that chart is if you'll simply scroll down just slightly farther, and you can even just do this right from the start when you get to this page, just scroll right down to where it says estimated monthly drug costs. It's going to say, in addition to your $13.80 monthly premium you'll pay each and every month just to have this coverage, this tells you the total monthly premiums you'll pay each month for all of your medications combined. So based on this example, I'll pay $4 per month, and you can see it stays the same all year long. Where did that $4 per month come from? Well, if we scroll up just a little bit, we can see that we're going to pay $1 for lisinopril, $3 for venlafaxine, totaling $4. And so this is the easiest way to simply see how much, when you go to the pharmacy each month and pick up your medications, it's going to cost for all of your medications combined. So that's really the simplest way to look at the details. I'm going to scroll back up here to the top. And to get back to the main page with all of the plans, we just simply click the back to search results. And again, 9.5 out of 10 times, the first plan recommended at the top of the page is going to be your best option, because that's simply the one that's going to save you the most over the course of the year. When you're ready to sign up for your prescription drug plan, you can simply scroll down just below the section for the plan that you want to enroll in. So in this case, let's say we wanted to enroll in the Clear Spring Health prescription drug plan. We would just scroll down, and right here where this says open enrollment starts October 15th, on October 15th, that will be replaced by a green button that says Enroll Now. So all you have to do is just click that green Enroll Now, and it's going to take you right into the simple application, and you can complete the paperwork in just a few minutes. It's really simple. All they ask for is your name, address, your Medicare number, so you'll need that red, white, and blue Medicare card nearby, and a few other simple questions, and you'll be all signed up for your new coverage and ready to go for the next year, or you'll be ready to go if you're turning 65 and enrolling in coverage for the first time. Now that, ladies and gentlemen, is how to use the Medicare.gov Plan Finder tool to shop for 2021 Medicare plans. Thanks for watching, and I sure hope you found this video helpful.